Hello and welcome back to Medical Compliance with Clarissa. I'm Clarissa Benfield, our Global Director and Business Line Leader for our Medical and Laboratory Business at Intertech. And today I'm so happy to be joined by my guest, Nick Jermstad. Hi, Nick. How are you?
I'm great. How are you, Clarissa?
I'm doing so well. So happy to have you on the podcast today. So as I always do to kick us off, I would love to know a little bit about you, what your background is, and how you got started in the industry.
Absolutely. So again, I'm Nick Jermstad. I'm our Senior Director of Toxicology and Environmental Assessment at Intertech. I've been with Intertech for about 10 years, primarily leading our toxicology department. My group works with toxicology for home and personal care products, medical devices, food and food packaging. I started in the industry about a little over 20 years ago with a background in cosmetics and general toxicology. So I've been working with Intertech and our clients on various toxicology and regulatory projects.
Yeah, and it's really exciting to have you. I think, toxicology is a very kind of general sweeping term, right? There's a lot that comes under the umbrella when we say toxicology and what that means. And obviously it's incredibly relevant to medical device manufacturers and what they're doing. Today, I think I really want to dive into Prop 65, which I think is something, of course, that people are familiar with, just, going about your day-to-day life, especially if you've ever been to the state of California. People are super familiar with Prop 65. So maybe you can just give a bit of an overview as to when you see a Prop 60, like what is Prop 65? How does it apply in general? How does it apply specifically to med devices? Just so everyone is kind of on the same page, and then we'll dive into some of the specifics.
Absolutely. So a very common question that we receive is, I just heard about this new regulation called Prop 65. Can you make sure our products comply with it? Prop 65 is not new. It's been around since 1986. Almost 40 years now. And it was voted on by the people of California. And basically what it is it's a list of carcinogens and reproductive toxins as deemed by the state of California. And if they are in your product and they can be exposed to people when they use the product as intended, then a warning sticker is needed on the label stating such. It has to state this product contains a substance known by the state of California to cause cancer or reproductive toxicity. So obviously it's not ideal. You don't want to have those stickers on your label. There are different ways that you can get around it, which we'll get into later. But primarily you'll see that, as you said, they're really all over the place in California. You'll see them at restaurants and bars because of ethanol or alcohol. You'll see them at Disneyland, actually. You'll see them everywhere in California. So you see them quite a bit. So we primarily try to help our customers and our clients go through different ways of avoiding that ugly warning sticker on the label.
Yeah, and so in general, right, when you're talking about this, right, Prop 65 applies to everything, including medical devices, right? So there's no exemption. A lot of times I think, when we're looking at medical devices or medical products, people think maybe there's an exemption or a way to get out of certain requirements due to the fact that they are critical care or life-saving. But Prop 65 applies to medical devices just like it applies to any other product.
Exactly. There is no exemption for medical devices. Even if it is approved by FDA, it still has to go under, it could be under Prop 65. So you have to make sure that everything is covered when we're talking about your actual products, whether it's a device, whether it's a cosmetic, those types of products. One thing to add, it is only for the state of California. Some people will say, well, then I just won't get into California. Well, California is huge.
Good luck with that.
Yeah. California is obviously the largest state in the U.S. If it was its own country, it would have the largest economy in the world. So exactly. Good luck with that. If you're going to do business, you're probably doing business in California.
Yeah, especially for medical devices, right? And we know that, right? It's one of the largest areas where medical devices are developed. It's one of the largest areas where medical devices are sold. So we know that obviously they're everywhere throughout the state. You did mention a little bit about a couple of the different types of chemicals. So can you give kind of a generic overview of what we're talking about? What types of chemicals are included under Prop 65? Things that maybe people might be familiar with, know of, maybe other things that people are less familiar with?
Yep, absolutely. And this is probably the biggest reason why some people might say that is Prop 65 new, because they do add substances onto the list. Again, it's anything that the state of California deems to be a carcinogen or reproductive toxin. So things obviously change, data can change. They do take a couple off once in a while, but in general, they are adding to this list. Again, right now, there's about 900 substances on the list. These substances can be heavy metals like lead, cadmium, chromium, and then phthalates, BPA, acrylamide. So some somewhat substances that you may see. But again, the key here is that if the person can be exposed to those substances while using the actual product.
Yeah, and then with that, are there specific levels, right? So I have my medical device. Obviously, I have to put my Prop 65 label on if I have a certain amount of that within my product. How does that actually work in practice?
Right, great question. So of those 900 substances, about 300 of them, so about a third, have a safe harbor level. So if you can show that yes, my medical device might contain lead, it's below the safe harbor level for that substance. Therefore, you do not have to have that warning on the label. So again, about a third of them do. There are different ways if you find a substance that does not have that safe harbor level, there are different ways, and that's when the toxicologist can come in. They can either complete tests, they can complete an exposure assessment to show that while yes, lead or a Prop 65 substance is in the product, if you use the product as intended, there is no exposure that could cause harm.
Yeah. And then with the actual process itself and applying the label has to be on the device. It goes on the manual. It goes on the outside packaging. How does that work? Again, in practice, if I'm a medical device manufacturer and I have to put this warning label on my product.
Right. So if you're say, yeah, it's in there and we're above this level, we're going to have to do it, then yes. As you said, it has to be on the project or on the product so people know it before they buy it, basically. So that's what they're looking for. And they just want to make sure that it is labeled appropriately if you do have to have that Prop 65 label on the product.
So knowing before you buy it. So if it's a small medical consumer type device, it would have to be obviously visible on the packaging somewhere so someone would know it if it's a consumer purchasing it. And then if it's in a hospital or clinical environment, it's just the procurement. It doesn't have to be on the device when it's actually being used. Let's say like a piece of MRI equipment in an actual facility.
Correct. It does not have to be on that device then. It just has to be on the device before the whoever buys it, before the consumer buys it. Correct.
Yeah, and I want to talk a little bit more too. So you talk about like these different levels and significant exposure and what that means. And then, toxicologists can help someone through that process. So what does that part look like, right? Let's say you identify that you have these substances within your product. You want to maybe not have to have a label, or you want to take your exposures down. Like how do you actually work with a toxicologist to make that happen for a device once it's, almost ready to go into the field?
Right. So with our clients, we basically have three phases, and sometimes we skip a phase or that, but the three primary phases are: the first one is basically a data gap analysis. So you're going through all your raw materials. So what is your product made out of? If it's made out of plastic, what type of plastic? Then you want to reach out to those suppliers and see exactly what's in it, whether it's through an SDS, the certificate of analysis. You can just straight up ask them, have a Prop 65 declaration. Are there any Prop 65 substances in your raw material that you supply us? Have you completed testing for that? So once you gather all the information for every raw material, then you can do some calculations and see that, yes, that there might have been a phthalate in the raw material, but it's at a very low level. And it's not going to cause harm, and therefore we're done. So many times after phase one, we did our due diligence. We went through all the raw materials. We don't see any Prop 65 substances, so we're done. If you do find some Prop 65 substances, based on the raw material analysis and based on those initial calculations, then you may want to say, well, yeah, based on the calculations it is, but those are, kind of theoretical. So you may want to do some testing. And so you may want to get in touch with a testing lab to complete a testing to see actually what's in your product. So you have the theoretical value based on the raw materials, but now that you actually have the product coming together, people are going to use it, whether they're going to use it orally, dermally, inhale it. You can complete a test like that to get the actual data. And then once you have that data, then you can really do the calculations and exposure assessment to see, okay, we have the final product, we tested for this, we identified the potential Prop 65 substances of concern. Now we can see if it's actually going to be a concern and see if it's above or below that safe harbor level. So that's really where the toxicologists come in, and having an expert that can complete all those tests and walk you through that. And then at the end, give you a conclusion if a warning label is needed or not. The primary, people will come to us. It may be too late. So again, I think we might have skipped a step about how Prop 65 is enforced. Prop 65, while it was passed by the state of California, they also didn't have all the resources to actively enforce it. So they actually rely on the people in California called bounty hunters, which sounds a little wild west, but that's what they're known as. But they can be very sophisticated. They can be law firms, they can be testing labs, and they go to Walmart, they go to Home Depot, and they'll take products off the shelf. It could be a medical device, it can be a hammer and nails, it can be a medical device, to see exactly if there are any Prop 65 substances in those products, and if a label is on there. And to be clear, if you want to be compliant with Prop 65 and you want to have that warning sticker on your label, you can go ahead and do that, and then you're in compliance with Prop 65. The issue is for medical devices and things in personal care that people put directly on their bodies or that they consume. It's not a great marketing tool to have that ugly label, or that ugly warning on the label. So that's where we come. That's where we come in. If a bounty hunter does test your product and finds that, then they'll actually sue you in court. It's called a 60-day notice, where you have 60 days to reply to the bounty hunter's request. And the thing is, if you already did those 3 phases, if you went through all those things and you have a full report, and you submit that back to the bounty hunter right away, they're more than likely they're going to go away. They don't want to go to court. That costs them money. So once they see that you have a defense and you've done your due diligence to show that there is no Prop 65 issue with your product, more times than not, that'll be the end of the story and you'll be okay. If they send you a 60-day notice and you have nothing, that's where the issues can come in. And unfortunately, we do have clients who come to us and maybe just a little too late. They're not going to have 60 days to put all that testing, all that raw material, all the due diligence that we just explained. Sometimes that takes time. So it's important to do it before you get into trouble, so to speak. Make sure you have everything set before you get to that point.
Yeah, that's really good advice and a really good tip, because just knowing that it could be randomly selected, right? You have to have all of that documentation ready, similar to as you would any other technical declaration, right? So as you would have your technical file, as you would have anything ready to go, this should all be readily available to show that you've done your due diligence with your product as well as with your suppliers, right? Which I think for a lot of people, the suppliers issue is obviously one of the biggest concerns, right? So if I'm getting components or materials that are sourced from suppliers, you're trusting your suppliers, it goes to your manufacturing process, right? What if something breaks down along that process, right? That can be kind of a scary point, because you're like, we did everything on the front end. We did our due diligence. We had our specifications. We send it off to manufacturing. Someone pulls a product off the shelf. They're testing it. And now, oh, wait, suddenly now it's non-compliance.
Exactly right. So it can be scary, especially if you think you're covered and then something like that does happen. But, if you have done the work, then it's important to show that work. If you are being sued and they are asking for this documentation, then show that you have done that work. And again, once they see that, it kind of scares them off, knowing that you've done all of this. Something else I also want to come back to is regarding the testing. It's not a one size fits all for Prop 65. Again, a very common request that we get is that I have this toothbrush. I want to test it for Prop 65. Well, it's very difficult to do that without doing those phases, and you don't know what to test for. Going back to Prop 65, there are over 900 substances on Prop 65. You can't test for over 900 substances. That's not really doable. So that's why it is important to go through the whole process of the phase one to go through all your raw material, all raw materials and your whole formulation to see what Prop 65 substances are most likely to be in that toothbrush or whatever product it is, to see what you have to do. So it is it's not a very easy process as far as from a testing point of view. It's just you have to do it the right way and go through all the steps to make sure that you're completely covered.
Yeah, and I think now too, right? I mean, everyone's familiar. You're not going to have none of these substances in your product, right? I mean, there's 900 of them, right? You're going to have some in some varying degree, right, in some level in your product, and so it's understanding that full process, because again, you're not going to go through the effort of testing for all 900. You want to go through the step-by-step approach. Are people looking to come in and do this testing to say, okay, is there a way to get the Prop 65 label removed? Is there a way to take some of these substances out? Is that the end goal for a lot of people, or is it just to know and have that information readily available to say we're below the limits, we put our warning label on, we know that we're good? Or is it, hey, we want to test to make sure maybe there's something we can remove, a component we can remove, or something we can source differently, so we can just get rid of that label altogether?
Absolutely. And that's a very common request and something that we help a lot of our clients out with is they know that they have lead in a certain raw material. So they want to know if they switch raw materials that doesn't have lead in it or doesn't have a Prop 65 substance in it, then yes, they can absolutely remove that warning label. So that's definitely the goal. It's going to help with marketing and help, if your competitor doesn't have the Prop 65 warning and you do, a lot of folks are going to go to the competitor that doesn't have that warning. It could be the exact same product for the most part, and at the end of the day, the same exposure, but it might have that little bit that could help you. But yes, we absolutely help our clients with that. Also, sometimes it depends on what test that they're referencing to why they think they need a Prop 65 substance. A lot of medical devices, and again, going back to a toothbrush, let's say the handle on that toothbrush, doing a total content test on the handle of a toothbrush may not be the most applicable test. We have other tests, like a wipe test, that just tests for dermal contact. You're not going to eat the actual handle of a toothbrush, so oral exposure really isn't relevant. What's relevant is if there's any residual phthalates or BPA that can come off of that toothbrush. So it's a specialized piece of paper that wipes it, and it checks for residual BPA, residual heavy metals, and phthalates that could come off of that. So yeah, it may be in there, but if it's not coming off, if it's not coming to direct contact with the skin, then it's not a harm, and therefore Prop 65 is not applicable if there is no contact with those substances. So again, it's important that you do the right tests as well.
Yeah. Yeah, and I think it's good examples that you're giving too, right? Where we see this big move towards more consumer medical devices, smaller medical devices, devices that are sold over the counter, right? It's not just all big pieces of capital equipment that are going into hospitals, right? Where, if you're going in for an MRI, do you care if there's a Prop 65 label on it? Probably not, because you need an MRI, right? So when you think about some of these smaller, where you have consumers making decisions, where you're thinking about marketing, where you're thinking about who's going to be buying, if it's this versus that, I think that really does obviously come into play, because now you're playing on people's, individual buying habits for sure.
Exactly right. And even, back to the MRI, people that are operating the MRI as well, on a daily basis, in the keypad, that plastic keypad, that also could have, Prop 65 substances on it as well. It's something else to keep in mind. Again, and it's both the patient in the MRI and the person actually, working the MRI is what would come into play. So things like that people sometimes forget about is that the keypad or remote control that could have plastic and metals on it, you want to make sure that those are below the safe harbor levels as well if your substance or if your product does not have a label on it.
Yeah. And so thinking about things that people maybe forget or have questions on, what if the device is sold outside of California? So sold somewhere else and then brought into the state of California. So I've sold it, distributed it, whatever, and now it's being brought into the state of California, and now it gets flagged somewhere, someone picks it up. How do you deal with those situations as a manufacturer?
Great question. And again, it goes back to what we originally talked about. If your strategy is to stay out of California, good luck. Eventually, it's probably going to get there. And so basically, you are responsible. So whoever makes that product, whoever made it and manufactured it is going to be responsible at the end of the day. There are ways that there are contracts that you can, specifically call out Prop 65 and say, no, I don't want it in there. But it's still, at the end of the day, it's going to be very difficult to do that. So you do have to basically, even if you are making it in Massachusetts and eventually it's going to get to California, you do want to comply with Prop 65. At the end of the day, if there is a Prop 65 issue, you will be held liable.
Okay, that's good for people to know. Well, Nick, this was a great conversation. Lots of really good information. If anyone has contact questions that they want, they can always reach out to me. I can give you Nick's contact information. Happy to connect you. And again, thank you so much for joining.
All right. Thank you, Clarissa. I really appreciate it.